Hey, good morning there, all of my nurse friends out there in cyberspace. I'm so glad you decided to come with us today on another exciting CE webinar presented by Paragon Education. I do appreciate all of you being here this morning. For me in California, here in the smoky northern area of California, where we are fighting a myriad of brush fires caused by some crazy lightning. Remember, there is no such thing as climate change, though, right? Ha, ha, ha. Good Lord. Again, thank you all for being here. We've got people from all over the US. That is the wonder and the merriment of the cyber education process of the webinar. So again, I thank you all for being here today, and let's get started. Disclosures always have to be done. No, I'm not being paid off by Big Pharma. No, you don't have to worry about that. I believe, one of the most impartial people, and I really kind of tell it like it is. I'm very real. God forbid Big Pharma was giving me big bucks. I would tell you all about it. And I'd tell you how you could get it too. So let me introduce myself. Those of you who don't know me, my name is Cheryl Randolph. I am the owner of Paragon Education. We specialize in nursing education for critical care nurses. So that means you, my ER and ICU people. But we also have a variety of other subject matter. We have topics that we're going to be introducing on obstetrics, on pediatric nursing, on flight nursing, on nurse wellness. So we're going to have a myriad of new titles coming out that hopefully will interest all of you. For myself, again, I've got an emergency ICU background. That's what I've done for the past, good God, 32 years. I know there are some of you out there that are not even 32 years old. My goodness, if I could, I would drink your blood. But I've earned my stripes through thick and thin over the last 32 years. The past 22 years, if you can believe it, I've been at San Francisco General Hospital. We are a level 1 trauma center in the heart of San Francisco. So everything that you could imagine comes into a big time trauma center. Been there, done that. Great fun when you never know what's walking in your door at any one time. And I think all of my ED friends, we all kind of share that passion. So by the way, a couple webinar rules. All of you out there, obviously you're in listen mode. I'm the only one that's chatting it up. But if you got something to say, if you got a question, please put it in the chat box. I'll try to respond as quickly as I can to the subject that we're discussing at that moment. Try to stay engaged with this webinar. Listen to what we're saying. Listen to what I'm saying. That was the editorial we. That was the royal we. Try to listen to what's being said. Stay focused. This is just going to be, 1 hour lecture, so not too reserving, or not too taxing rather, on your reserves. So hopefully that will be okay. But again, the great wonder of the webinar is that for those of you at home and you're wearing yoga pants and got a cup of coffee, or I don't know, hey, it's home. Maybe you got a mimosa in front of you. Stay comfy, stay cozy, put the dog on your lap, pet the cat, whatever works for you. So ready, my folks? Let's begin. Now, have you ever stayed in a bad job just because you loved your team, that they were someone that you looked forward to seeing? You came in morning shift report and you were like, you're here. Oh, great. And you just knew you were going to have a fabulous day because all your buds were there. And on the flip of the coin, have you ever quit a good job because you hated your coworkers? It was toxic. It was evil. I had one job that, no lie, guys, I kept a bottle of Maalox in my car. And before I went in every morning, I would chug half the bottle of Maalox because I was so stressed out about, good God, what was going to happen today? What fight was going to happen? What toxic, evil person was going to be there that was going to screw up my calm and mess up my ability to be the fabulous ER nurse? So yeah, our environment, our coworkers totally make up a huge part of our enthusiasm as being an emergency nurse. But again, this idea of bullying in practice, it's not simply ER practice. It's every single field that's out there. It's horrific. It is something that touches all of us. So I think it's a really germane topic for the present. Now, if someone out there is saying, oh God, I don't know what the hell she's talking about. I have never been bullied in my practice. I have never had a problem. Well, you know what? That's probably because you're probably the bully. You're probably the one that's bringing it on. If you say that there's not a problem, well, you know what? It's probably you that's causing it. You're that mean nurse that we're all afraid of. In real life, I mean, think back through your life, my ER, ICU, nursing friends. Think back through your career. Think back through your life. I mean, maybe you were the kid that got beat up and you got your lunch money stolen. Maybe you were the kid that someone made fun of for whatever reason in grammar school, in high school. Maybe you were the science nerd. Maybe you were the, I don't know what, the goth in high school. Everyone somewhere, somehow has been bullied, has been made to feel that they're not part of a group, that others against them. And it's even more horrific, I think, when it's in our professional practice, because we're idealists. Nursing professionals are always seeing the silver lining. We are always seeing the ability to rise above. And when it comes down to having people around us and the environment around us as a toxic waste dump, we're more confused by it, I think, than anything else. It's really literally like, what the hell? Here in 2020 America, I think the whole concept of bullying is a regrettable part of our culture. You cannot deny that it's out there. And unfortunately, it oftentimes has gotten some, I don't want to say respectability, but certainly it's gotten notice, and it's gotten more prevalent, I think, in our culture because there is a certain amount of tolerance for it. That is exactly the opposite of what we should be having for this bullying culture, for this bullying concept in any part of our culture. I don't care if it's your kid going to school, you walking down the street, making a vote, or being in your profession of medical healthcare. So what's the definition of bullying? I kind of love this list. Look at this. It's persistent, it's repeated, it's malicious, it's offensive, it's intimidating behavior. Ultimately, it humiliates, degrades, displays a lack of dignity, a lack of respect, and it leaves you feeling vulnerable and threatened. I think that is a fabulous definition of what bullying actually is. When you take it down to the nursing environment, it's a little teeny bit more specific. Any kind of inappropriate behavior, anything ranging from verbal abuse, physical abuse, sexual harassment by your fellow nurses. And it can be either what we say covert or overt. Covert means it's kind of like hidden. Overt means it's out there and pretty visible and kind of jaw-dropping what's going on. And ultimately, these bullies, it's their frustration, their anger that's getting spewed out into the masses. Now, there's some other terms for bullying these days. Again, in medicine, as you know, we can never have one name for anything. We got to have 6 different names so that everyone gets confused. But in the professional literature, sometimes they call this, I love this one, horizontal hostility. Can you imagine that? Going up to someone and go, hey, I feel you're horizontally hostile. Would you knock it off? I like this one too. Relational aggression, lateral violence. All of these are just sociological terms that are used by people who are living in an office by themselves and they're typing out a research article. But the easy fact is that, yeah, this is all bullying. And frankly, the concept hasn't changed since you were 6 years old. Unfortunately, there is a fair amount of nurse-on-nurse badness that happens. I know you've all heard of the concept that nurses eat their young. Exactly true. For a lot of us, again, I've been doing this gig for a while, and I kind of realized early on that it was a true fact of practice, that it was out there. And I, as a new nurse at 100 years ago, coming into it, anytime I ever made a comment or was trying to commiserate with my fellow new nurses, we all just kind of realized, hey, you got to suck it up. This is something that's out there. You got to pay your dues. Does anyone ever remember hearing that? You have to pay your dues. You have to do your time. You got to suck it up. And it was just understood that that was there, and it was part of who we really were as a nurse culture. The truth is, bullying, again, it's destructive. It's targeted behavior. It really has to be recognized and called out in order to eliminate it. You sweep it under the carpet, and sure enough, that's where it's going to stay. So what creates a bully? Well, you know what? It's a very personal thing. These bullies are created in the same way that violence in families and violence in interpersonal relationships gets created. They oftentimes have come from a culture or a family situation or a family dynamic that has bullying at the heart of it. And they learn that as a coping mechanism. They learn it's better to be the bully. It's safer for them to be the one on top screaming down at everyone else, as opposed to being what they would perceive as the victim. So sure enough, it's a personal thing. It's wrought with anxiety, with anger, with vengeance that creates this person. And again, frankly, although this concept today that we're talking about is primarily in nursing, in healthcare, this is something that you can extrapolate throughout the lifespan. Again, you look back at your life as a school student, in grammar school, in middle school, in high school, and you can point to specific instances in your life, personal experience, that definitely had that bullying factor in it. So what's the problem with these bullies anyway? Well, strangely enough, I mean, if you want to dig deep in their psychological consciousness or lack thereof, these are people who ultimately, they really are not confident. They really are not the person who is personally self-actualized and confident in their skill and pleased with where they are in life. They are someone who sees anyone outside of their immediate circle as a threat. For older nurses, sometimes older nurses are seeing those youngins as a threat. They're seeing this as someone who's taking over their place. Those younger nurses that are out there, hey, likewise too, they can feel threatened by the skill and confidence and the abilities that their elders have. And again, I never say that I'm an old nurse. I say I'm a vintage nurse. I'm here in wine country, so I'm vintage. Again, ultimately, this is almost always from a deep psychological bent. It's almost always a learned behavior that they grew up with. So it's not something that in their personal repertoire of life growing skills is going to change instantly. It's something that's been there for quite a while. Now, in this bullying environment, none of this is happening in a vacuum. So it goes on for a good length of time. There are certain known entities that cause the trouble. There are certain cliques that maybe are immune from the trouble. Some people are going to learn that, hey, maybe if I'm watching this happen, I can be a bystander and just back off from it and not get involved at all. Some people will try to ignore it. Some people will realize, hey, this is the culture of this place, and maybe I should be a bully as opposed to being a victim. So all of these dynamics are going on in a bullying environment. And ultimately, it's just perpetuating this toxic cycle, this toxic environment that you're in. The studies have shown that the concept of nurse bullying happens early, and it's there from the time you're in nursing school to the time that you're at the bedside. Look at this, 2018 study. So just 2 years ago, they did this study. The data came out. They said 78% of nursing students said that they were bullied in nursing school. Yeah, I remember that. I remember in nursing school, anytime I would question any action or course of study that we were taking, I got sent to the principal's office and told that I wasn't getting along, that wasn't appropriate behavior, that you were never supposed to question what the instructors were saying or doing to you. I went to a nursing school that all of the instructors were old Army nurses. And for whatever reason, they had a really militaristic approach to teaching. And it was truly like bullying. I felt like for the first year, it was like Full Metal Jacket. It was like being in boot camp. And there was no reason whatsoever for that attitude or that teaching style to be perpetuated. When I became a nurse educator, when I taught nursing school, every day I would wake up and think, I'm not going to be the teacher that I had in nursing school. Look at this other stat from this study. They say 60% of nurses leave their first job within the first 6 months. 6 months on the job, and you question what you've done. You question the career path that you've taken. Isn't that horrific? And they're leaving because of the behavior of their coworkers. Astonishing. Now, we all know when we started down that pathway of being a professional registered nurse, we all know that, hey, it was a hell of a lot of time, a hell of a lot of money that we put in for our education and our preparation. But ultimately, another study says that up to 43% of newly licensed nurses, so the newbie nurses, 43% of them leave their first jobs in the first 3 years. Almost 50% attrition of the newbies are taken off. And where are they going? Well, you know what? They're going somewhere that they're not getting beat on, that they're not getting psychologically abused every single day. They're going somewhere where someone is patting them on their head and saying, hey, this is a good job. You're doing good. Hey, let's be a team. Hey, let's do this together. That's where they're going. God forbid they can't find any clinical environment that's worthwhile for them. Well, you know what? Maybe those are the people who are going to those non-clinical roles. Those are the people that after 2 years in practice, they say, hell with this. I'm going to go be a clinical nurse leader and be in management. I'm going to be in a clinic. I'm going to go somewhere else just because they've realized, hey, this environment is so toxic. So who's the victim? Well, you know what? Victims in this circumstance, when we're talking about nurse bullying, the victims are almost always people for whom they perceive a lack of power on their own. And frankly, when a bully perceives someone with less power, with less confidence, with less stand up for yourselfness, those are the people that they're going to be harping on. Those are the people that they're going to be abusing. So who is that? Obviously, oh God, our darling little nursing students. God forbid you're a preceptor. God forbid those instructors drop off a group of little nursing ducks on your doorstep at 7 a.m. Those students are so powerless. They're getting beaten up in school every day. And then they come to us and we're yelling at them and telling them, hey, they don't know what the hell they're doing. New staff, again, those newbie nurses coming fresh out of school. Yeah, we're mean to them. Any kind of travel nurse. God bless you, my traveler friends. I so appreciate you coming in to help us out. We're always understaffed. We're always underemployed. But you know what? You're that new person in that new environment. You've done it 100 ways different to Sunday. And sometimes you get into this brand new environment where everyone there has done it the same way for 20 years. And you come in with new ideas and fresh enthusiasm, and they just totally beat you up. Techs, medical assistants, our CNAs, all those people who are in a perceived lesser power position, sure enough, a nurse bully is going to pounce on that. And anyone who in and of itself just lets it go on. If you try to ignore it, you try not to see it, you're someone who's tolerant of it, you're isolated from those nursing cliques for whatever reason, sure enough, you are fitting the profile of the victim. Now, why does this happen more in the emergency room than anywhere else? Well, you know what? We've got a really fast-paced environment. Things are changing on a dime. We've got a hierarchical structure. You know, you've got your, especially if you work in a teaching hospital, I've got attendings, fellows, residents, interns, medical students, nurses, nursing students, travelers, paramedic students. I mean, there's this whole hierarchy of who's on top, and that hierarchy is changing all the time. In July, those of you who work in a teaching hospital, that hierarchy gets turned on its head, right? You got your new baby doctors coming in. They were a medical student yesterday and now they're a doctor. Wow, it's a tipsy-turvy environment. And the fact of these roles changing all the time makes it really confusing to know, hey, who's on top, who's giving who orders to who. And you know what? Even the fact that they call them doctor's orders, doesn't that just connotate in your mind that it's someone from on high, someone above you, someone who necessarily could be, shouting down and not necessarily collegially working when you call it a doctor's order? I always kind of like to think of it as doctor's suggestions. We're in a collaborative practice and hey, let's talk about, hey, what should we do to get this done? What should we do to help this patient out? I think we need to change that whole idea of doctor's orders. I think that kind of perpetuates this idea. There's definitely a gender imbalance in nursing overall. And that's something that really hasn't changed so much over the years. Even though we have more guys than we ever probably had in practice, it's still a more heavily weighed female environment. And you know what? My husband always used to laugh and say, oh my God, put a bunch of women together and it's cats in a bag. There's some truth to that. When you have a little bit too much one gender or the other, there can be some gamesmanship. There can be some comeuppance that's going on. In ER, again, the fact that we've got all these different levels of practice means that some people know more than others, both clinically and educationally. And there's always going to be a certain hierarchy with the various cliques or practices that are out there. Like I said, you've got your attendings, you've got residents, you got interns, you got medical students, you've got all these different people coming in and out. Then you've got the medical services that you've tapped, especially in ER. We say, hey, we need a neuro consult. I need a cardiac consult. So you've got that whole clique that comes in. You've got the other services in our hospital, like you've got that whole clerical department. You've got those techs. You've got RT that's helping you out. You've got the radiology people. You've got pharmacy. So you've got all these different layers of personnel, all these different layers of authority. And sometimes the response for people of kind of keeping it all sane is to try to yell and scream and bully to be at the top of the pyramid. Is this a surprise? It says here, bullying is more likely to occur in high stress settings with high stake outcomes, heavy workloads, and low job autonomy. Oh my God, they should put that in the job description for emergency nurse, right? Can you think of another practice? I mean, well, I don't know, maybe my flight nurse friends are saying, yeah, this applies to us too. Yeah. Critical care nursing practice. I don't care if you're a flight nurse, a transport nurse, ICU, CCU, ER, trauma. We are all in a hugely high stress situation. We've got life or death decisions that we're making on a dime. Our workloads are always increasing. And sometimes we don't always have a lot of power to do things the right way or to do things that need to get done. In addition, I mean, we've got every single freaking day, there are life and death decisions that you're making. It is enough to, make you kind of crazy. So the concepts of bullying, what's actually happening? Well, there's overt bullying. Okay, overt, or think obvious. This is when you are just basically getting yelled at, getting criticized, getting told, hey, you're no good, you're not doing it the right way. Name calling. Maybe it comes down to racial profiling. Maybe it comes down to sexual harassment. Maybe it comes down to ageism. I myself have been told by a couple coworkers who were younger than me that, oh, well, that's old school. Oh, well, is that how you used to do it? Oh, is that how they did it 20 years ago? And I literally had to tell these youngins, hey, you know what? You're being a bully. Stop this. Do not use my age and experience as a tool against me. I am happy to help you. I am happy to do whatever we can to get the job done here. We are a team. And how dare you use my age and experience against me. Direct threats. I mean, there's some people, think back in your life experience as a nurse. There have been people that I'm sure have just come out and said, hey, I don't want to work with you. Hey, I don't like your work ethic. I don't like the way you're working. I don't like the way you're doing this. Micromanaging. Good God. If you want to send an experienced, confident nurse off the rails, micromanage them. We don't do well with that whole micromanage thing. In fact, I've gotten to the point where, again, I don't know if you noticed, I'm pretty verbal. I'm not one that kind of lets this stuff roll off. I'm very direct. Direct is the nice way to say that. In my career, I've had charge nurses or God forbid, other coworkers try to micromanage me and tell me how to do something or how to do my practice. And you know what? You got to call it right when you see it and say, hey, no. Hey, I'm experienced. I'm confident. I know what I'm doing. Do not micromanage me. Go work on your own practice instead. Now, then there's covert bullying. Covert bullying is a little bit more under the radar, probably the best way to say that. Covert operations. You always think of those military operations that are in like a Sylvester Stallone movie. Those are always covert, right? So covert means that it's kind of under the radar. It's kind of veiled. It's a little bit hidden. It's things that are kind of passive aggressive, kind of indirect criticisms. It's when maybe some rumor gets started about you or your practice. It's when you or someone else is spreading gossip about our other ER players. It's withholding information. Maybe you needed X, Y, and Z to get the job done, but hey, no one told you about Z. So when you try to do the job, hey, you're going to screw it up because they didn't give you the full amount of information. Unfair assignments. Oh my dear God. Years ago, I had a charge nurse that I would always have 3 or 4 patients while everyone else had like 1. And when I ever said anything about it, the response was, hey, I'm the charge nurse and I decide who gets the patients and you're the one who needs to do these. So it's a real thing. It's out there. Microaggressions is the new term. You may have heard this before, but it's a newer term for this type of covert, demeaning, loosely veiled threats to the confidence of that doctor or nurse. The pictures that you see over here on the side, this is actually from the ACEP website, ACEP, American College of Emergency Physicians. That's our brother and sister organization of our ER docs. Look at this. Nurse, can you find me a doctor? Yeah, because you know what? She's a woman doctor. They automatically assume that she's a nurse because she's a female. Lady in the center, Asian American. She's being asked, hey, do you speak English? Gentleman at the end, he doesn't look like a white American male. So someone's saying to him, hey, are there any doctors from America here? Oh my dear God, these are microaggressions. These are the kind of covert bullying terms that obviously the pictures here, this is coming from a patient population, but you can see how easily this could come from nurses as well, or within the medical profession. Now, these microaggressions can also be very racially based. And I put this here again, just to kind of remind us that, some of these comments, God forbid, these have ever been said to you. I hope and pray they've never been uttered by yourself, but you can see how hurtful, how demeaning, how racially motivated and evil that any of these comments could be. Look at this one. You don't act like a normal Black person. Your name is too hard to pronounce. Can I call you Mary? What do your people think about that? What are you? Oh my dear God, could you ever imagine saying that to someone? What are you? Hey, you're on my team. You're part of my staff. You're a registered nurse. As far as I'm concerned, you are in my tribe. My tribe is all inclusive. I'm just happy that you're there and you got a pulse and you're helping me take care of business. So again, these comments are out there. They are horrific. They are hurtful. They do not help us perpetuate our job. They don't help us get the job done. And again, being aware of these things, being aware of how hurtful and demeaning and derogatory and not helping our mission forward is the way that this is going to go away. God forbid you hear someone say this, hey, poke them in the ribs and say, hey, what the heck are you talking about? Hey, that's not right. Hey, you shouldn't be saying that. Because sometimes I think people will say these things and they don't even realize how horrific it is. So who's doing this bullying? Well, again, this is from on high. Sometimes it's our managers, it's our directors, it's our charge nurses, it's our fellow nurses. Maybe it's the doctors, maybe it's the other departments. Younger and older nurses have consistently had words back and forth. Male nurses can bully the females. Females can bully the male. And we have all kinds of one-on-one action going on. RNs might be mistreating the LVNs. LVNs maybe are coming back at the RNs and yelling at them. Or look at this cute little meme that's here. ER nurse is giving a report and she says, hey, listen, I'll save you the mystery. Life-saving us, head-to-toe assessments and bed baths is you guys. You know that this meme is talking to the med-surg floors, right? We will say things like this. This is hurtful. This is not appropriate. We are consistently always, oh my gosh, my dear ER and ICU friends, we are always coming down hard on our brothers and sisters in med-surg because all we're ever thinking about is getting the job done, getting it done, transferring that patient, getting those treatments done, getting them where they need to go. And sure enough, it can come off as bullying. It can come off as being really mean to those other nurses. We think we're getting the job done. We think we are the ones on high, but it's hurtful. And we really need to stop and think about sometimes what we're saying, what we're doing, how we're coming off to these other nurses. I love these two little memes. These always come out at Christmas. Look at this. Merry Christmas to the ICU nurses. Love the emergency nurses. Yeah, look at the tangled lights. That's kind of the way we roll. And likewise, the ICU nurses, they're putting it right back at us. And they say, hey, Merry Christmas to the ED nurses. Love ICU. Sure enough, look at that. They took that tangled mess and they made order of it. So sure enough, again, there's always been rivalry and criticism of services and specialties. It's been going on forever. But we need to take notice of that. We've always kind of cloaked it in a joke. And gosh, that's what bullies do, right? A bully says something horrible. And then when that person says, hey, why are you saying that? They say, oh, I'm just joking. It's just a joke. Lighten up. I'm just making fun. Yeah, you know what? That's what bullies do. So if you've ever been that one that has had to say, oh, I'm just joking. Hey, sure enough, it might be because, yeah, you're the bully. So let's talk about who's in the gallery of bullies. There is the super nurse. Super nurse. Super nurse is someone who's been there, done that. They got all the initials. They got all the credentials. They're on all the committees. They're smarty pants. They know everything, do everything, been there, done that. Totally superior to all the rest of us. Totally rising above. They're condescending. You ask for help and you get a lecture. You ask for advice and you get a look of, they'll roll their eyes at you and say, well, don't you know that? Don't you know how to do that? Instead of getting some help. Has anyone ever seen this person in practice? There's the resentful nurse. This is someone who is just so mean and hurtful and grudging that everything that has ever been said to them, done to them, every conversation in life that has ever gone between them and any other person in their professional circle is recognized as confrontational, as a threat. And this is someone who likes to create drama. There's someone that likes to stir the pot. Do you know these people? How about the rude nurse? This is the one that is spreading that gossip. This is the one who's spreading those rumors. This is someone who's whispering in other people's ears and saying, oh, well, have you heard about this? And have you heard what they did the other day? And did you hear, oh my gosh, did you hear how they handled that code? This, oh my gosh, their patient didn't do well, you know? This is someone who's just spreading malicious, horrific, gossiping, bad impressions to the rest of the people, and doing it just under the cover of gossip, under the cover of chatting about the other people. Strangely enough, that rude nurse, they are always the one that, God forbid you say anything to them, they are the first one to take offense and the first one to say, oh my God, how dare you say that to me? How dare you treat me like that? Oh my gosh. They're the first person to take offense. How about the backstabber? The backstabber, oh my gosh, I've met a couple of these in my practice. You think they're your friend. You think there's someone that you can chat with. You think there's someone that you can confidentially say, hey, I feel this way about what's going on. Hey, I had this happen the other day. Gosh, I didn't feel so confident about that code the other day, and we did this and that. You think they're your confidant. You think they're your friend, and they're helping you out, and they're a sounding board. And then what happens? No. They turn right around, and maybe they take that information to the charge nurse, they take that information to the manager, and pretty soon you're getting called into the manager's office and being asked about, well, hey, I heard the code didn't go the other way. Hey, I heard your patient fell out of bed and it was because you didn't put the side rail up. And I heard that you did this. Suddenly, all these things that you had talked to someone in confidence and talked in a collegial manner, a collaborative practice, suddenly all that stuff is out in the open to management or other people who are going to do something punitive to you. How about this one? The nurse who's green with envy. Maybe you are that person that's got all the initials. Maybe you are that person that's got all the smarts. And instead of respecting that, or instead of using any of your talents or any of your abilities to help other people out, maybe they just make fun of you for that. It's like, oh yeah, you got all these initials. Oh yeah, well, big deal. Yeah, it's not about the initials. It's not about, well, I could have those initials if I wanted to. I just haven't bothered taking any of those tests. I just haven't bothered doing any of those CE classes that you always talk about. Yeah, those are the people that their lack of achievement or their lack of experience or their lack of credentialing, they see you as a threat because maybe you have all of that. How about the clicks? Oh my gosh, I got to tell you, my brothers and sisters here, I don't know, I'm in the confessional booth here. I got to tell you, 100 years ago, I worked in an ICU and I had the best group of friends. Absolutely loved going to work because I had this group of friends. Gosh, there was like about 6 or 8 of us. And we had all gone through a preceptor program together. Some of us had been in nursing school together, and we knew that we all had each other's back. It was a great group. Every day I saw them, I felt empowered and felt like I was going great with my practice. It was a really confident time for me. And ultimately, what I realized and what my other coworkers started realizing was that we were a clique. And in fact, they called us the clique. If there was 2 or 3 of us together, some other nurse would come up and look at us and go, the clique is here today. And in retrospect, I look back at that. And at the time, I kind of thought it was funny and I thought it was cute. And oh yeah, you're laughing at the fact that I have this group of friends. But in retrospect, I realized that, God forbid, maybe we were, as a group, maybe we were intimidating. As a group, maybe we were people who were excluding others from being in our circle of trust, our circle of friends. And I kind of cringe at maybe what my behavior was back in the day, because again, I saw the clique as a a force that was giving me power and giving me confidence. And I didn't realize how that was coming off to others. You know, even the bosses have this bullying behavior on their mind. It doesn't matter if you are an LVN, an RT tech, you're a doctor of pharmacy, or you're the CEO of the hospital. There is bullying that's coming from all directions and even on high. There was a study that was done a couple of years ago, 2018. And look at this, 60% of nurse managers and directors said that they experienced bullying. And 26% of those people, almost 30%, a third of your managers and directors said that the bullying that they were experiencing, they considered it to be severe. Severe. You think you're getting beat up on? Yeah, so are your managers, so are your directors. Ultimately, the tone that is set by leadership can contribute to this bullying culture. You got a leader, you've got a director, a manager, a charge nurse that's a bully. Hey, maybe everyone else takes that as the template for practice, and maybe that's how everyone starts working. Everyone starts acting that way. When you have managers, supervisors who lead by intimidation, who lead by fear, sure enough, that's going to get fostered in your staff. When you have a lack of authority from on high and you have a high level of accountability, well, you know what? Those managers, God bless them, those directors, they feel powerless as well because they've got a lot of accountability, but maybe they don't have so much authority because people on high are telling them what to do. A lot of people in management have had management styles adopted by modeling what they learned, modeling from their bad boss, thinking they've always got to be that heavy hand, that speaking from on high person, as opposed to that collegial person who is helping their team, helping their units achieve what they need to do. And again, when bullying becomes part of this organizational culture, when it's understood that you got a director who's not supporting you and they're being evil and mean, you got a manager who's not supporting you and being evil and mean, sure enough, it's going to filter down to your charge nurses and to your staff. Sure enough. And even as those nurses, like we said earlier, like up to a third, 37% of those new nurses are bugging out in a couple of years. When they recognize, hey, this is a hurtful place to work, sure enough, they're going to leave that sinking ship. Now, these nurse managers, these nurse directors that are also getting yelled at and screamed at, if you've ever been in one of these organizations, you know that the way you see that, or the way that it gets kind of filtered down from you, is that maybe they just tune you out. Maybe you have no power, no voice, no nothing. Maybe there's never a nurse who's on a committee talking about nursing practice. Maybe there's policies that come out and they have no grounding in the real world of what actually goes on because they were never written or discussed by someone who's actually in practice. Any kind of lack of support for this primary mission that we're doing, this primary care of our patients in ICU and ER on the medical floors, when there's a lack of support for that, it's often because, again, these bosses, these directors, these managers are not doing any kind of two-way communication. They're getting grief from on high, and all they're doing is sending it further down the pike and not recognizing that, hey, maybe if I got some information from my staff nurses, maybe if I got some feedback from the people who are actually doing the job, maybe this wouldn't be a problem. Now, here's a shocking thing. Here we are in the year 2020. Oh my God, 2020, dumpster fire, 2020. Here's the deal. In 2030, in 10 years, there's going to be a 73% increase in the number of people over 65. Everyone should be hyperventilating at that statistic. You should be freaking out at that statistic. And half of that 73%, half of them are going to have some kind of chronic disease like, oh, I don't know, COPD, heart failure. How about all of our dialysis patients? Half of these people are going to have chronic disease. And chronic disease, as you know, at this moment in time, that accounts for 80% of our hospital admits. So if I've got that number is only going to go up, in 2030, things are going to go to hell in a handbasket. And God bless our baby boomer generation. And I got to say, it's me. Okay. Boomer. Hey, boomer. You know what? It's me. We are the largest and unfortunately unhealthiest population that's in the US at this moment. Of all of the groups, the Gen X, the millennials, the Gen Z people, the boomers are the biggest group. We're the sickest, and we're the ones who are going to be taking up all those hospital beds. Well, why is that important? Well, here's the reason why. Average nurse, when they finally get into a specialty practice, they're usually around 30 years old. The average age of a nurse these days is 50. Well, what that means is that here in America, retirement age is usually about 65. Well, yeah, it means that those people who are 50, they're going to be leaving the practice in the next 10 or 15 years. Duh, do the math. They are going to be 60, 65, and they're going to be taken off. And I don't know if you've seen this, but I've seen quite a few in my emergency room and in my ICU that people weren't even quite at retirement age, but it was like such a horrific, hard environment that they said, you know what, I'm out of here. I'm going to leave this place at 60. Yeah, I know we're short-staffed already. I know we're always hiring, but you know what? I can't even stay here to retirement. I'm freaking out of here. Look at this too. Nursing school faculty is also on the decline. We are not getting nursing school faculty members to either stay in the job or to even go into the job. As a result of that, you certainly can't have the appropriate number of students going into it. Obviously, you don't have the amount of clinical positions as well. And when you're not pumping out these little baby nurses from the nursing school, or you're pumping out lesser numbers, it is doomed to fail because we're going to have so many freaking sick people. Now, these nurses that are coming into practice and then going right through the revolving door, it's costing money. Look at this 2018 statistic. And again, you can always probably add 10% to this. They said the average cost of turnover for a bedside nurse. So once someone gets hired, goes through orientation, they're in practice, and then they figure out, hey, I'm the hell out of here. For that person to have gotten trained and assimilated into that position, it's costing that organization anywhere from $38,000 to $60,000 grand each person that goes through that revolving door. Average hospital, it says there, they're losing anywhere from $4 to $7 million a year just by the revolving door of nurses that are leaving what they're perceiving as a toxic environment. You think you want to be a magnet hospital? Are you someone who's on the magnet journey? You know what? You got a toxic environment. It's not happening. It will not happen. You have got to have people who are committed to a team spirit, who are committed to a collaborative practice. And that's the only way that you're going to get recognized and be able to do the job of those magnet hospitals. When you have that horrific, toxic environment, you know what happens? People call in sick. You know what happens? People don't want to take another patient. People get sick. People bring lawsuits upon the hospital or the organization or the individuals. All of those things happen. I don't know, raise your hand or I don't know, put your hand on your heart. If you have ever called in sick because the day before or 2 days before or 3 days before was such a horrible, hostile, toxic environment that you literally feel ill about going back to it the next day. Been there, here, I've done it, I'll admit it. I've called in sick for those, okay? That is perfectly understandable. that is sign of a toxic environment. And the again, just putting it in a dollars and cents fashion, they say that for all of us who are responding to those horrible situations in that way, it ends up costing the organization about 12 grand per nurse per year. So you look at how many nurses are on staff at your hospital, multiply it by 12 grand. That's the toxic cost that your hospital is paying for having a crappy environment that people are feeling threatened and horrible and don't want to go there. Now, even those of us who love our job, even those of us who can feel we handle the stress, the physical demands. Oh my God, my back is hurting. Oh my God, I feel so wiped out. Oh my God, I am so freaking burnt out. Even those of us who are in it for the long haul, and even those of us who feel we can stay in that environment, it's our love. We want to be that fabulous nurse that we know we are. Eventually, we can get driven out. Eventually, we can recognize, hey, you know what? This is just such a toxic environment. I'm out of here. Like I said in the very beginning, all of us have probably stayed in a crap job because you had fabulous people and your best buds and you had a great team, and it didn't matter that it was rearranging deck chairs on the Titanic every day. It didn't even matter because you were doing it together and you were doing your best. But we've also all had those jobs that, oh my God, I was drinking half a bottle of Maalox in the parking lot before I went into work. And finally, I realized I got to get out of here. We've all been in those positions. When they look at what actually impacts job satisfaction, what they found out was that it's the environment that's most important. People say that it's the collegial environment or lack thereof. It's that supporting environment or lack thereof that makes them either stay or go away from a job. It's more important to us than our salary. It's more important than what you're paying me. It's more important than benefits. I've had jobs that they'll, every single day there's a text that says, hey, come to work. We're paying overtime. We're paying double time. And you know what? You look at that and you're like, no, can't do it. Doesn't even matter. Doesn't even matter how much money you're giving me because it's so hurtful. I don't even want to go in. Incivility in the workplace is what's linked to job dissatisfaction, nursing burnout, nursing illness, the attrition, that revolving door of people going in and out. And when you're in a constant burnout stage, you know what? You're out of there. So what happens to us from a physical standpoint? Well, look at the list that's here. Headaches, frequent illness, you're depressed, you're anxious, reduced productivity. Yeah. You know what? I am not the best nurse I can be when I'm totally stressed out. I'm so freaked out that I'm questioning everything I do. I'm double checking. Oh my God, I got to check my charting. Wait, maybe I should check the policy. Oh my God, let me juggle this while I juggle that. Oh yeah, hey, I'm not getting any support there. Hey, oh God, can someone help me? I'm drowning. All of those things. I call in sick. I'm absent. I hate going to work. God forbid it bubbles over and then I'm being mean to my kids. I'm being mean to my significant other. God forbid I internalize all of this hurtful stress. Suicide is perceived as the only way out sometimes. So it can actually go to that. This is wrong. This cannot continue. So what do you need? Well, you need an environment that has what we call a just culture, a culture of zero tolerance for bullying, a culture that says if there can be a problem, if bullying exists, we stamp it out, we call it out, we do things about it. We don't sweep it under the carpet. We have a healthy environment because we realize that's how the job gets done. That's how my people are happy. That's how the customers, that's how our patients get happy. Organizations have to admit that there's a problem. Anyone who says, oh, our organization, our hospital doesn't have any problem with bullying. No, that's never happened at our place. Well, you know what? Somewhere, some way, even if you've got that perfect, beautiful unicorns in the hallway kind of hospital, there's a rainbow over the building. Even if you've got that perfect place, you know what? Maybe someday a bully gets hired there and they bring that dismal black cloud to your place. So as long as your organization exists, you're going to have to realize that I got to have a contingency. I got to have a plan. I got to have a policy for what we do about bullying, even if I don't think it's actively happening in this place at this moment, because maybe it happens tomorrow. So what can you do? Well, you need to start at the top. Management needs to be the ones who are walking the walk and talking the talk. Management needs to be the ones that are the heroes. They need to be the ones that are championing our cause, what we need, how to take care of us, and how to get the job done. We got to have managers who are setting the standard, managers, leaders, directors, charge nurses, all those clinical nurse leaders. Choose any of those titles. Those are the people that need to be modeling the behavior that they expect their employees to follow. If there are particular situational factors that you can point to that are stressing us out and making a hostile environment, you got to fix it. Maybe you realize that, oh my God, in my ER, if I try to take care of 6 patients at once, I screw it up. I can't keep it straight. It's an unsafe situation. So maybe I need to adjust my ratios. Maybe I need to adjust my workload. I need my hospital to commit to a zero tolerance policy. It needs to be understood that no, this whole bullying thing does not go here. We need to say specifically what we will not put up with. All those behaviors that were on the other slides, those covert and overt aggressions, all of those need to be in black and white on the policy and saying, hey, there is no room for this. You do not get to hit your staff. You do not get to ridicule your staff. You do not get to insult them. You do not need to, or you do not get to say racially motivated terms to them. You do not get to do preferential assignments. All of those things that are there need to be in a policy, in addition to a policy that continues, hey, when a bullying behavior is identified, it gets called on the carpet. We need to take a stance and recognize that any bullying episode that's brought out into the light needs to get addressed instantly. It gets confronted by the person to whom it's being displayed. It gets told on to charge nurse, manager, whatever the system is. Forms get filled out, but it needs to be something that gets taken care of right away. We also need to recognize that those of us who are deeply affected by this, those of us who are mentally anguished by this process, we need to know that there's help for us. We need to know that it's okay to say, hey, I'm having a really hard time coping with this, and there need to be resources that I can go to help me out. In your online social media stuff as well for your organization, that needs to be on there as well. It's one thing to have a paper policy that's in a book that maybe someone may or may not look at, or maybe it's in your intranet and someone may or may not look at it. But it's another thing that potentially you say, these things will not be tolerated by our organization. Hey, we want community at large to know that we do not tolerate this. This is how we roll at my hospital. We do not tolerate that. We need to let everyone know, both staff, our healthcare team, the patients, the community at large. We need to let them know, hey, this is how it's done. This is how a professional organization is run. So we need to hold ourselves accountable. You see something going on, you say something about it. Someone says something to you about you, you confront them. It's not easy. It's not easy. It's kind of a David and Goliath. If you've been in these situations and you confront that bully, you ask them to stop. You call them about what their behavior is, what they said to you, what they did to you, inappropriate touching, whatever they did, you call them on it at that moment. And it's difficult. It's oftentimes you feel it's easier if I just don't have to say anything. I'll just let it go this time. But you know what? That's how it perpetuates. So if you're the one who's being harassed, you know what? Use the B word. Bitch, no, bully. You call it to their face. You call it a bully. You report it to your manager. You report it to your supervisor, your charge nurse. Keep a record of it, because you know what? There's often patterns of these things that go on and on and on. Write down who was there, when it was, what they did, any witnesses that saw it. Because oftentimes it's not just that one incident. Maybe it's a whole pattern of behavior that's happening. And every single time that charge nurse is on, you have 5 patients and everyone else has 2. Maybe every time that manager is on, they are inappropriately, touching you or tapping you on the shoulder or making some kind of physical touch that's not appropriate. These patterns are there that need to be recognized, that need to be documented. That's how it's going to be going away. So what's ultimately going to happen when you have a progressive, understanding organization that's doing these things? Well, you know what? You call these people on the carpet. Maybe they start off with a verbal warning. Then maybe it goes to a written warning. Maybe they get suspended. Maybe they get freaking fired, okay? Because maybe that's what needs to happen. But it's recognized that the organization needs to have a particular way that this is handled, and it's handled professionally. It's handled where you believe the victim and you recognize that that's part of a toxic environment that's having an effect not only on that victim, but on everyone else that's in the staff. Again, your culture needs to be zero tolerance for this. You cannot have any kind of acquiescence or ignoring of nurse bullying activity and consider yourself to be a professional organization. It needs to be called on the carpet immediately, and there is zero tolerance for this nonsense. Not only zero tolerance for the activity of bullying itself, but we need to recognize that within the policy, within the organization, there needs to be protection from any kind of retribution of you reporting that behavior. God forbid you say, hey, X, Y, and Z is happening, and then you get in trouble for it. Whistleblowing is what they call that. That is, from a federal standpoint, it's illegal. From a California labor law, that's also illegal. But organizations need to have that also in their policy, that it's understood that you, by bringing that behavior to the light, you're not going to get in trouble for it. So here's your take home, my friends. This is a systemic problem. It's well established in our culture. It's well established in nursing school. It continues throughout your career. But you know what? Here's how we're going to get rid of it. We get rid of it by acknowledging that it's out there, saying, here's how the microaggressions, here's the signs and symptoms of it, and here's how we're going to get rid of it. We're going to have a policy that says there's zero tolerance. We're going to have written policies of a professional organization that say we do not tolerate this, that perpetrators get called on the carpet, they get verbal written warnings, they get terminated. This is not part of our policy. Sorry, this is not part of our professional image that we want to project to the mass public. Bullying has no place whatsoever in the nursing profession. It has no place whatsoever in the medical environment. So my nurse friends, I'm leaving you with the quote of, get this, do no harm, but take no shit. All right. I want you to be safe. I want you to be confident. I want you to feel protected in your practice. I want you to feel that you've always got members of your nurse tribe that are there to support you and to get the job done. I love you. I mean it. Thank you so much for joining me today. Please, you do have a email link to complete the course evaluation. When you complete that course evaluation, it will generate then your CE certificate. I love you, my friends. I'm so glad you joined me today. We will be presenting every single month. We will have a free webinar. So we will make sure to send you an invitation every time we've got one of these coming up with our time and date and the fabulous new topic. If any of you know any new and exciting topic that you'd like us to present in any 1 hour or longer session, please let us know. We are very responsive. We have a fabulous team here at Paragon that has a plethora, wide-ranging skill set and knowledge base, and we are more than happy to put out exactly what you need to keep you skilled and interested and proud of your profession. I love you, my ER friends. I love you, my nursing friends, my cyber nurses. Do not come into my hospital ER because I will cut off your clothes. Peace. I love you. See you later.